Hello everyone, it is me, Dr. Fez. Yes, I'm starting this video because I am now the king of fitness, and I actually have somebody incredible with me today who's going to be taking us through it, but technically it's my workout. It's Queen Fitness, Mapule. Welcome.
Hello everybody. Guys, I'm here for the drama. I also need motivation. Sometimes, you gotta lift that load off of your shoulder, but I'm so excited to be with Dr. Fez again on another Medshield Movement workout. So today we're gonna do a lot of mobility. I see a lot of people have been saying, you know what, with all these hectic exercises, we are so stiff, our hips are tight, our shoulders are tight. What must happen now? We can't move. What must happen? You were actually meant to help us be able to be mobile and functional. So we heard you guys, and now we are here for mobility. I see the warm-up is already
Getting there.
Without any waste of time, I think we must just dive straight into what Dr. Fez is doing. You just want to do that hip rotation.
There we go. And I think it's always important to remember that you can be strong, but if you aren't mobile, if you aren't stretching, you get a chance of actually getting into injuries. Once you get injured, life becomes that much more difficult. So just remember to do the recovery type workouts that don't necessarily make you sweat because you're getting the heart rate up, but they make you sweat because you are mobilizing. Because sometimes some of us get stiff.
Yeah, so guys, as Dr. Fez has explained, that it's important that you do the mobility work. We want to prevent you from any injuries, and also it will make it easier for you to articulate a lot of movements. So
articulate
and relax. So without any waste of time, we're gonna go into all fours. We'll just do 10 counts actually, it depends on how long you can hold a stretch. If we're doing a stretch, if you're doing a mobility movement, as you want to do it as often so that you can actually push to a wider range than before. So in this position, I'm just going to go into this position so that you see exactly what we are doing. We're going to do cat and cow. Okay, so keep your back nice and straight first, right? Tuck the belly button in. You want your knees to be under your hips. So bring your knees right here, bring it here. There we go, there we go. Shoulders over there, that's perfect. So you don't want to be here or too close. You want hips over knees, shoulders over elbows and wrist. Now, round your back, push out. Imagine you were pulling your spine to the ceiling. There's a string that's pulling you up to the ceiling. You tuck in your tailbone, coccyx. Right, doctor?
Perfect. Very anatomically correct.
Tuck it in and then exhale out. And now you're pushing down. Now, remember they pulled the string. Now, imagine now someone is just pushing you all the way down. Open the chest, right, and inhale, round, tuck in your chin, round your back, all the way. Now push wider than before, like you want a much wider range, and exhale out. Push all the way down. Open your chest. Let's do one more. In. Ooh. Hold it, hold it. How long can you hold your breath? And exhale. Ooh. Nice. Sure. How was that?
Feels amazing. It feels like my spine is actually starting to open up.
Open up a little bit, which is very important. That's what we're trying to do. And now we're gonna thread the needle. So in a very same position, okay. You wanna use one arm and reach between your arm and your leg, the opposite side. You reach all the way down. You want to drop your shoulder. So you see, you're gonna get a different angle from Dr. Fez, and you get a side view from my side. So now your palm is face down, And then try and reach, bend the other arm, the elbow, reach, hold it there, drop your head to the floor. We're just gonna hold it before we do the mobility work. Just hold it, static hold. And now release it out. Now I want you to open it out, reach to the ceiling. Okay, we're gonna do 3 counts. It's gonna be a little bit faster now because we're holding the position. So you go in and out. Let's go in. And then bring it back up. And reach to the ceiling. In. Bring it back up. 3 more, in. Ooh. Bring it back up. 2 more. Ooh. Last one. And release. Well done. Oh, that felt like a workout already.
It did. I feel like the whole thoracic region of my spine is just alive.
Okay, now we're gonna do the other side. Remember the first one, we go in, we hold it a little bit longer, we breathe 5 counts, and then we go into the mobility work. You ready?
Yeah, boo.
So, all the way in, the opposite arm, bend the elbow, reach, palm facing down, rest your head on the mat. And hold it just there. You should feel a nice stretch on your lat. Hold it there. And release. All the way up, open. So now third in, down, reach, out, in, out, good. 3 more, in, there, out, plus 2, one more, and relax. So now let's rotate the shoulders, roll shoulders back, roll shoulders back. Give me 10 counts. 4, 3, 2, 1. Roll it forward. 1, 2, 3, 4. Okay, while we are there, let's do like a quick hip opening, right? This isn't, it looks easy, but it's not easy. A lot of people sit for longer hours, so we're just gonna give you a quick one that will stretch your hips, right? You're gonna go into a lunge position where your back leg, your knee is on the ground. So now I want you to push forward, reaching into your toes, push forward, but now you're opening the chest. Keep your back nice and straight, open that hip. To make it even harder, bring your arms together, overhead, and stretch it out. You should be feeling a stretch there. But now let's make it even harder. Reach to the side, go to the opposite side. Can you feel that stretch? Ooh.
I can feel it.
There we go.
It's a really great stretch for runners because when it comes to the hip flexors, they can get quite tight and it stretches out the tensor fascia lata, which actually allows your lateral side of your leg to open so you don't get runner's knee.
And release. This is why I have Dr. Fez here. So he can say all those crazy words. So please rewind and go Google.
Listen, there we go.
Let's switch to the legs. We're about to finish it off, so guys, and then you push forward. There. Don't worry, we'll be doing a lot more mobility exercises moving forward so that you get different ones for different parts of your body. But now we're doing a quick one. Remember, mobility work, it doesn't have to be too long or too much. You just have to build it up slowly. Exactly. And to the other side, reach. Ah. Oh.
Ooh, I can feel that.
I know. Then you feel one side is probably tighter than the other side. Usually there's always that one dramatic side. It's either strong or weak. And you must do a lot of lateral movements. And release. Let's finish it off nicely into a child's pose. On your knees, sit on your heels, stretch your arms forward, drop your head and relax. Ooh, this feels so good.
It's well deserved.
Okay, what you can do is just push the knees out to the side so that you can get a nice range of motion. Whew. That felt so good.
There's a lot of tightness I didn't know I had.
And release. Well done everybody. Remember, like I said, we're going to be bringing you a lot more mobility exercises so that we make sure that we prevent you from any injuries, and we make sure that when you do the crazy exercises, you are quite mobile to be able to do the exercises with us. We do appreciate you working out with us. Remember to invite your friends to join in on another Medshield Movement workout. And I'd like to extend my gratitude to Dr. Fez for always being with us and motivating us. And actually, it's important to have an accountability partner, and I have mine right next to me.
And I feel like she's elevated me because I went from normal person to Prince Fitness to now King Fitness. I feel like I'm just getting better and better. And I loved this workout because I've seen a lot of patients who come in and they are great, they're bodybuilders, they're strength people, but they start coming in with all sorts of niggles because they aren't doing workouts like this after we have sometimes our usual intense workouts. So bank this one after a day that you've had a really good Medshield kind of movement and a strong workout. Do this the very next day.
Well, thank you so much for joining us once again. Do remember to invite your friends and family, boyfriend, husband, kids. Everyone is welcome to join us for the Medshield Movement workout. And don't forget to check out the website for all our amazing Medshield medical scheme packages catered for you, specifically for you. So see you next time as we continue with our mobility work.